Good morning. We're glad that you're here. Thank you so much for joining us. And we're very excited for our first Distinguished Speaker Series of 2021. I know that we're already on the 19th of January, but I still want to wish you a very happy new year. And I know that we all share the same sentiment of hope for a healthy new year. So thanks for joining us. For those of you who are not familiar with myself, my name is Nancy Walters. I'm the Executive Director of the La Jolla Community Center. And if you're not sure what the Community Center is, we are a nonprofit organization that helps to serve the seniors in our community. Our mission is to promote lifelong learning, wellness, and friendship, and we do that by providing programs and services. So if you're not familiar with the programming that we have available, please visit our website. There's programs listed there from yoga and meditation to art and cooking and music appreciation, as well as many speaker series. So I hope that you can join us for that. Our Wednesday Connect program is also back. That's a casual get-together where we feature a speaker and we connect, engage, and learn with other members of the community. And we have great ones coming up this month. For tomorrow, we have Healthy Made Easy with nutritionists who are available to answer your questions. And on the 27th, we have an introduction to memoir writing. So again, please visit our website. It's ljcommunitycenter.org to learn more about our programming. And with that being said, I want to thank Dr. Mona Hacker for joining us today to discuss and answer your questions on such an important topic, COVID-19 and the vaccines. So we're happy to have a speaker with us today who can provide an overview of the virus situation from development of clinical trials to administration of the vaccines. So as you may or may not know, the San Diego Health System and Distribution Centers have begun to administer vaccines, and Dr. Hacker will help us learn more about the distribution plans, the different vaccines, side effects, and the efficacy of the vaccines. So we will allow extra time today for Dr. Hacker to respond to some of your questions. Some have already been submitted, but if you have additional questions, please feel free to use the chat function and we'll try to get to your questions during the presentation. So it's my pleasure to introduce Dr. Mona Hacker. Dr. Hacker is a board-certified family practice physician in San Diego. She has vast experience in clinical trials and has participated as a principal investigator and sub-investigator on over 100 clinical trials in a wide range of therapeutic areas. Dr. Hacker completed her medical training at UC Irvine and went on to accept a family practice residency in Seattle, Washington. Since returning to San Diego, she has spent over 10 years in the clinical trial space. She also frequently appears on local media to provide a valuable perspective on new developments in the medical field. Please help me welcome Dr. Mona Hacker.
Thank you so much. Thank you so much. It's really an honor to be here today. I have been closely following, as we talked about, the COVID-19 situation for my weekly updates on KUSI News and other radio stations. So I have been looking at this really closely and kind of trying to find, weed through a lot of the information that's out there to kind of get people the information that they need based on science and facts, based on, really looking at the data. So I try to just sort of communicate that so that each of us can make our own individual decisions about whatever it is we may be doing with our health, including right now kind of the hot topic and the big topic, COVID-19. As Barbara said, I am a family practice physician, but over the last 15 years, I've been working in clinical research and clinical trials. Done clinical trials in everything from knee arthritis to menopause. So, a lot of different therapeutic areas, and really understand how clinical trials happen, what the stages are, sort of FDA requirements and things like that. And so that being said, I will move on to my next slide. Just a little bit about my background. I know we already talked about it, but I am from San Diego. I went to Torrey Pines High School and then to UC San Diego and UC Irvine, and then did my residency in Washington. And like I said, the last 12 to 15 years, I've been doing clinical research and FDA clinical trials, and also doing a lot of media. For the last 6 years, I've been doing media spots on KUSI as their medical sort of correspondent or expert in different areas. Let's just get started. I'm going to start with a little bit of background about COVID-19. I think everyone knows information about it since it's been on the news since since, last year, and we've been hearing a lot about it, and maybe hearing too much about it, but I'm going to just start with a little bit of an overview and background so that we all kind of have the same basic information, and then we'll move on to sort of more specifics about the vaccine and things like that. So just in general, and not to put up these grim numbers all the time, but these are some of the latest numbers, as you can see in the chart, worldwide, in the US, California, and then San Diego. And we are, of course, right now seeing a big increase in the number of cases, especially in California, and the hospitals are filling up and things like that. So we're hearing a lot more about these COVID cases. If, since March, since we first locked down, right now we're kind of at our worst numbers and increases. So hopefully, as the holidays are kind of a month out now, or coming to a month out, we'll see a decrease in that, and as vaccinations start ramping up. So I guess we'll see what happens with all of that. I think it's also important to know that two things that I always try to stress: about 80% of people that get COVID have very mild symptoms to none. Some are asymptomatic. So we got to keep that in the back of our head when we see these terrible numbers and numbers of deaths. So that is something that we want to keep in mind. And about 15% are hospitalized in the US. That's a little bit less. And we have about a 1 to 2% death rate in the US. Worldwide, it's a little bit higher. And if you want to compare your risk, whatever age you're at, to a healthy 18 to 29-year-old, I just have some stats there as far as your risk of hospitalization being higher as we go up in age, and risk of death, of course, exponentially kind of getting higher as we go up in age. That's not to say those numbers, though, overall are still not huge. So when you hear these numbers, I like to put them in perspective so that we're not all terrified if we are in that 75 to 84 age group or something like that. So this is just an overview of the numbers. And then we will move on to, again, the basics. I'll just quickly, I know we've all heard about how to stop the spread, the masks, the distancing, hand washing, cleaning and disinfecting. I'm just putting that in there just to keep us all reminded until we get enough people vaccinated. This is still going to be kind of what the only things that we've got to stop the spread. So important things to just, again, just sort of remember. And this is a quick, many of you may have already seen this. This has been all over the internet, just showing with ultraviolet light germs and bacteria on someone's hand, over washing for a certain amount of time, and how, the 6-second hand wash isn't really doing a good enough job, and we really need to be doing a more thorough job with our hand washing. So this is a slide, many of you may have already seen this slide, but I like to just put that in. I think a visual sometimes is really helpful. So now when it comes to COVID, one of the things that there's a lot of confusion about is testing. And I also do get a lot of questions about, I had this test and what do I do with it and things like that. So just the basics about testing to understand, there are two big types of tests when it comes to COVID-19. There are the diagnostic and the non-diagnostic. What do I mean by that? The diagnostic tests are going to tell us, do I have COVID-19 right now? And there's two types of those tests. There's sort of the molecular test and the antigen test. And again, these are scientific terms, but really how you've probably heard about them are the rapid tests and the other test, the PCR tests. The molecular test, which is that first column there, are those PCR tests, which are the gold standard, the really accurate test that you're going to have that nasal swab in the nose. They're going to be sent to a lab, and it's probably going to take, depending on how many tests are being done at a certain time, a couple of days, up to a week to get these results back. Those, however, are the most accurate. So that is, like I said, the gold standard. Then there are the antigen tests, which are those rapid tests, which are not quite as accurate, especially if you're asymptomatic and have no symptoms. You may get a negative test, even though you have COVID, because you might not just have enough for the test to detect. So something to keep in mind. And then when I talk about the non-diagnostic tests, I think that this is where there's the most confusion, those antibody tests. And a lot of people will talk about antibody tests. Antibody tests don't say you have COVID right now. They just show whether you ever had it in the past. And antibodies, again, are our body's reaction to an infection. We build up these antibodies, and so that's what they're looking for in these tests. And again, there's a great if you want more information about this or have confusion about tests, the CDC website does explain it, I think, really well with some really great graphics. So that's somewhere that I would have people go if they want more information about the types of tests and understanding the types of tests. So what's in all this news that we've been talking about, all the numbers and the bad news, there is some good news. The good news is the science. The good news is this vaccine data that we now have back. And we have 2 vaccines in the United States that have what we call EUA, or emergency use authorization. What does that mean? That doesn't mean that they're fully approved like other vaccines that have been FDA approved. But right now, in this current situation, the FDA has given them emergency use authorization so they can be used and given out. The 2 vaccines that are out there right now are the Pfizer BioNTech and the Moderna vaccine. Most of you in the community, like myself, because I'm a community physician, I'm not a hospital physician, will probably at this point, if you're getting the vaccine, probably get the Moderna vaccine. And there's a couple of reasons for that. And we'll talk about that a little bit more. But those are the 2 that have this emergency use authorization. And a question that I get often is, how do they get this emergency use authorization? We hear a lot about how quickly these vaccines kind of got approved, and that gives people some pause because people are worried that maybe these vaccines didn't go through all the steps that other vaccines have had to go through. And so really, are they safe? And what do we need to know about that? So I'm going to just do a little bit of background about clinical trials in general. And in the United States, the FDA has phases of clinical trials that often can take years to go through for new drugs and new vaccines and things like that. In phase 1, we look at small groups of healthy participants when looking at a new drug or a new vaccine, and we just really look at, is it safe? Is it safe to give people, and at what sort of starting doses? Then in phase 2, we kind of look at more people, and we really look at, again, is it continuing to look safe? We still don't know if it works in phase 2. Really, we're not looking at that. We're just looking at, is it safe? And then in phase 3, which are the bigger trials with many more participants, then we're starting to look at both safety in larger numbers and efficacy. And when we talk about efficacy, we're talking about, does it work? Does it work for whatever the indication is that we're trying to look at? So both the Pfizer vaccine and the Moderna vaccine are currently in phase 3 trials. And these are really large phase 3 trials where they've taken in Pfizer about 30 and Moderna about 40,000 people, and they have given half of them the drug, the vaccine, and half of them what we call a placebo, or just a fake drug that's not, that has no clinical, just like saline or something, so they are getting nothing. And then they looked at those people, and they saw in both of them very similar results, that there was about a 95% reduction in getting COVID, developing symptoms of COVID in the group that got the vaccine. So in the cases of COVID that they saw in those big groups of people, the 30-some thousand people, 95% of the people that got COVID did not get the vaccine. And a lot of people, ask, how do they know about this number of 95%? That's where that number comes from. The other thing that what they also looked at is, after they got both shots, how long are we going to look at these, patients and people and see if they had any serious side effects? Is it safe? what the FDA did in this case is looked back at all the vaccines we've had in the past for, so many years. And they saw that most of the side effects, and the serious side effects especially, that we see in people that get a vaccine occur within the first 2 months of getting that vaccine. So the FDA required for these vaccines that we have 2 months of safety data. And that's what happened with Pfizer and with Moderna a little bit later. After 2 months of good safety data showing that there were, that the risks were low and that there were no really serious, terrible side effects, that's when these vaccines were able to apply for this emergency use authorization. The trial is still ongoing, even as we're giving the vaccine out to people. The people in the trial are still being followed and will continue to be followed for years to come to look at those long-term risks. So that's sort of just a little background on clinical trials. Now, first, I'm just going to talk briefly about the differences between the two vaccines, which is a question that I also get a lot. They're both a new type of technology and the same type of technology, and you might have heard about these mRNA vaccines. And there are some great videos that you can look at on the CDC website or on the World Health Organization website about exactly, if you want to get into more of the science of what an mRNA vaccine is. It is a very new, completely new type of technology. However, they have been looking at mRNA technology for 10 years because they were looking at that for some of the other SARS vaccines and also when they were looking at an HIV vaccine. So, I think some people are fearful that it just started in March and we've got this whole new technology. No, this technology has been being developed for years, but I think it got, of course, fast-tracked when COVID-19 kind of came onto the scene. So these mRNA vaccines are a genetic type of vaccine that do not inject in your body the virus at all. It's not a live virus. It's not an attenuated form of the virus. Instead, what we are having the body do is kind of trick the system into thinking it's seeing a protein on the virus. The thing about these new types of vaccines is that they're very unstable at higher temperatures. So storage and distribution becomes a factor, especially with Pfizer. It has to be stored at really, really low temperatures, which is why it's going to be hard to distribute in certain areas where you don't have a freezer that can, store things at minus 94 degrees Celsius. So far, and both of these vaccines also are 2 doses. With Pfizer, it's 21 days apart. With Moderna, it's 28 days apart. There is data right now that even after 1 dose, that data is looking like there is some protection even after 1 dose, maybe 50 to 80% effective. So that's more good news. And so far, the phase 3 results, we're not seeing anything new since the emergency use authorization came out as far as terrible side effects. But what we did see, and I'm sure many of you read about, is that in the UK, after they started giving some of the vaccines, they saw some severe anaphylaxis or severe allergic reactions. And we are seeing that here too. It is not very common. It's about 1 in 100,000 people having a severe allergic reaction, and even smaller numbers for that allergic reaction being life-threatening anaphylaxis. Usually it has been in people that have had a history of severe allergic reactions in the past to vaccines. And what they think right now is that those allergic reactions are due to having a sensitivity to one of the components of the virus, which is called a polyethylene glycol, or the PEG 2000. But they're still looking into that. So more to come on that. Again, here's the other vaccine, the Moderna vaccine. It doesn't need to be stored quite as cold, so it's a little easier to distribute. And hopefully here in California, we'll get quicker with our distribution, as we are not doing as well as many other states as far as the percentage of vaccines that have been distributed to people at this point. But hopefully with some of these super centers in San Diego and around California, that will change quickly. And again, the storage is a little different with Moderna, and its 2 doses are a little further more spread apart. But when people ask me a very common question, which one do I think is better? Based on what we know right now, their efficacy is very similar, and the side effect profile appears to be very similar as well. So really, I don't really have a preference, and I don't think there's really a preference in the literature right now. And at this point, I don't think we really, if we get the vaccine, have much of a choice as to which vaccine we're going to get. Most of us in the community are probably going to be getting, at this point, the Moderna vaccine. But there's also 3 more vaccines out there that are in the pipeline that are in phase 3 trials that haven't hit that 2-month safety data yet. But I expect in the next weeks to months, we're going to see more candidates out there getting that emergency use authorization. There's one from AstraZeneca, one from Johnson & Johnson, the Janssen, and the Novavax. And some of these may be less expensive and easier to distribute, which is good news since distribution has been such an issue. And so we'll keep waiting and watching on that data as well and following those. And of course, the most common question, and the question that everyone wants to know is, are these vaccines safe? What do we know about the safety? Here I've listed some of the common side effects. Side effects with these vaccines are quite common. A lot of people are having some side effects, some injection site pain, fatigue, headache, chills, fever, joint and muscle pain, and up to 25% of people who get the vaccine. Now, side effects are okay. Some of these side effects actually mean that our body's immune system is working. A fever as a response to a vaccine means our body is doing what we want it to do, which is ramp up our immune system to fight this virus and recognize this virus when we see it. So it's not necessarily a bad thing. And the key to remember with the side effects is that in most cases, they are quite temporary, less than a day, maybe a day or two. So they're temporary and transient. The one side effect that I know a lot of people are most concerned about, because we've heard about it, is of course the severe allergic reaction. Again, it's still rare, but we still do need more data on that. If you're somebody that has a history of allergic severe reactions to vaccines in the past, definitely something to talk to your doctor about before you get the vaccine. If you're allergic to any of the components of the vaccine, I definitely think that's another place to take pause and also talk to your doctor. But so far, the safety profiles, fortunately look great. And then I'm going to talk about a little bit about some common myths about the vaccines. And many of you may have some other questions about things you've heard, and I'm happy to take those as well. But these were some of the more common ones that I've heard on my Instagram and things like that. A lot of people ask, if I already had COVID, then I guess I don't need the vaccine. Right now, the CDC is recommending, even if you've had COVID, because everyone's response to COVID and the severity of their illness is very inconsistent. The vaccine gives a much more consistent, studied immune response. So after, 90 days after you've had COVID, we really don't know what protection you have from getting it again is at this point. So they are still recommending that people 90 days out get the vaccine. The second thing that I always hear is, can I get COVID from the vaccine? And the answer to that is absolutely no, you cannot. It is not, like I said, a live or attenuated virus in any way. So you cannot get coronavirus from the vaccine. Now, that also brings into, sort of play a few people that are reported in the news to have gotten coronavirus after they got the vaccine. Well, what happened in those cases is that those people were not yet fully immunized. They got the coronavirus less than 2 weeks out from their first vaccine. So they really weren't protected yet. And that's how, that kind of explains that. Another thing that I hear a lot is, well, I'm young, so I'm really not at any risks. Again, as we, the slide in the beginning, younger people do have much lower risks of severe illness. Severe illness in younger people is very rare. However, we have to also remember that regardless of age, there are some pre-existing conditions that really do increase your chances of COVID and having problems with COVID. Things like obesity, heart disease, lung disease, kidney disease, things like that can really increase your risk 6 times more of hospitalization and 12 times more of death, regardless of age. So, I know a lot of young people feel very, invincible, but, they've got to keep in mind also their pre-existing conditions. And then the other question I get is, once I'm vaccinated, can I not wear a mask? And hopefully once enough people are vaccinated, we will be able to go out and not have to mask up as we are right now. But for the time being, we still don't know. What we know about the vaccine is that it prevents you from getting sick with COVID. We don't know if it prevents you from getting it and still being able to spread it to someone else, even though you yourself are asymptomatic. So that is still unknown. Hopefully that will be the case, but we don't know that yet. And lastly, there's a lot of talk on the internet and social media about the vaccine altering your DNA. And that is not at all the mechanism of these mRNA vaccines. They don't actually incorporate anything into your DNA, so they will not alter your DNA. And if anyone has any other questions about things they've heard, please don't hesitate to ask at the end. So really the question that we all face right now is, is the vaccine right for me? Is it right for me? And I think that, really we've got to remember that, we're all different. We all have different medical histories. We all have different ideas about, what we want to do, how we feel about vaccines in general. I think the best thing in this situation is to really educate yourself as much as you are, like, coming to this talk and looking things up on really reliable sources, talking to your doctor. And really, the question really comes down to, do we know everything about the vaccine and do we know everything about COVID? And the answer to both of those is really no, we don't know everything about these things because they're new. And I think the real thing is that, is the risk of the illness worse than the risk of the vaccine? And I think for most people that is the case, that the potential risks of a vaccine are lower than the potential risks of getting, COVID-19, something we really don't know a whole lot about. So that's sort of my summary, but again, everyone is different, and you may have individual questions about this as well that I'm happy to take. And well, that's my overview. Thank you so much. It was great to share that with you, and I'm happy to take any questions about any of the latest things in the news about the new variant or anything like that that anyone is wondering about.
Thank you, Dr. Hacker. Thank you so much for this wonderful presentation. I think that we all have learned a lot, and a lot of our questions have been answered, but we do have some additional questions that have been submitted. One of them is, can you please provide a brief outline of the California rollout of vaccines?
Well, at the moment, as of yesterday, so we have different phases of the rollout. The phase 1A were healthcare workers and people in nursing facility, skilled nursing facilities, and that is still ongoing right now. And healthcare workers are, I think, they're ramping up the numbers of healthcare workers that are getting the vaccine at these super centers, like the one at Petco Park, and there's now one in Coronado, and where's the other one? So we're ramping that up. As of yesterday, people 75 and up are able to go onto the website and sign up for their vaccine, but the spaces are limited. And I will say, I tried for my parents to get them signed up, and I could not get them an appointment. So and the system is a little bit tricky, a little bit difficult to kind of navigate. So it takes a little bit of patience. when you look at the rollout overall and distribution overall, unfortunately, and I don't know why this is, California is not doing great as far as the number of vaccines we've received and the percent that have been given out. We're only at 30% of the vaccines that we've received being distributed to people that are in these phases that should be getting them, whereas other states are much higher, 60, 70, 80%. I think we're only second last to Alabama as far as our distribution has gone. So hopefully with these super centers opening up, this distribution will kind of speed up. And I wish I knew more about how all that happened. That's not, what I do, but whoever is in charge, I think they, Governor Newsom did come on and say it has been terrible and we're gonna try to ramp it up, and we'll see what happens over the next few weeks with that. Because after the 75 and up, hopefully it'll open up to 65 and up as well as soon as possible.
Thank you. Another question is, are there contraindications in taking other vaccines along with the COVID vaccine? So like the pneumonia vaccine along with this new vaccination?
No, there's nothing that says you can't get both vaccines at the same time. You can absolutely, and I hope everyone did get their flu shot as well. Flu numbers are way down this year, probably because of the masking and the disinfecting and the social distancing, because the flu is a lot less contagious. So all that has worked really well for the flu. But no, there's no contraindications known of right now that you can not get one, and with the COVID vaccine.
What are the most common early symptoms of COVID-19? A persistent cough or back pains is one of the questions.
The most common symptoms are fever, cough, and shortness of breath. But now there are many other symptoms that could, that people have had. Those are the most common. There's even people that have GI symptoms like nausea, vomiting, diarrhea, things like that. Some people have a runny nose or feel like they have a sinus infection. So we've kind of heard it all. And then there are, of course, also those people that are asymptomatic, that really have no symptoms. One of the symptoms that really kind of points to COVID that you don't see in a lot of other things is this loss of taste and smell. Pretty common with a lot of people that do end up testing positive or having COVID. And sometimes that symptom actually lasts even beyond that, couple weeks, and lasts for months. So we are seeing, I will just talk about this really quickly right now too, is that there are some people that even though they kind of had their acute illness, we're seeing a lot of people report that they're still really fatigued months later, that they're still don't have their taste and smell back months later. So we really don't know what the long-term, effects of those things are for some people. Other people are great in a week or 2 weeks and, feel back to normal. So it's, and I can't predict, I'm always telling my patients, I can't predict who you're going to be. I can't predict just, are you going to be somebody that's fine, or are you going to be somebody that's going to get really sick? I can't tell you.
Right. Thank you. Question from Pat asks, does the vaccine take care of the new strains of COVID?
That is a great question. So right now there is a strain that, the B117, which is what is kind of, causing a lot of havoc in the UK. And now we see it in the United States as well, of course, because we're kind of a global world. And at the moment, it looks like the mutations on that variant would still, the vaccine would still be effective towards it. So that's good news. We just certainly hope that the virus doesn't get so smart that it mutates to a point where the vaccine doesn't work. However, there is another new strain in California that they're seeing in Santa Clara that we don't know a whole lot yet about, but we are seeing it in a lot of the genetic sequencing in California. And that new strain has 3 mutations on it, and one of them is in one of those spike proteins, those proteins that kind of stick out, is what we're targeting in all our vaccines. And so there is some worry that because that it's mutated, is the vaccine going to work? And I wish I knew the answer, and I really hope it is, because that would really put a big wrench in a lot of things if this ends up being a very dominant strain at some point. Let's hope not. but we don't know yet.
Thank you. Tina asks, wondering about the vaccine safety in the very elderly. Her mom is 99 and lives in her own home. She knows COVID is very dangerous for her, but she's worried about vaccine side effects because she's very frail.
So that is a great question. When they did the studies, they did try to have the patients in those 30,000 patients or 40,000 patients that I was talking about, they did try to definitely have a distribution of ages and did have some elderly, more than 85-year-old people in it, and they didn't see a difference in the study. So I would say that, again, I don't know this particular 98-year-old, but I would say that it's, as long as, she doesn't have anything, let me go back. I'm sorry. I will say that I think that it is safe for someone who is 98 and frail to get the vaccine, and maybe even more important than someone that is, 80, because getting COVID could really, you don't know what that's going to do. But again, I do think in someone at that age, it is a good idea to have a discussion with your doctor or your care provider, because it is a scary thing to get a new vaccine. So I do think that that's something that should be discussed a little bit more. But the studies did look at the very elderly as well. There was a distribution of race, age, all types of things to make it good for most people.
Thank you.
Mm-hmm.
John asks, UT columnist Diane Bell is strongly advocating a pulse oximeter to help self-diagnose, and he's been using one for months, reading 99%. Do you recommend people buy and use these in general?
No, I mean, I don't think you need to go out and buy a pulse ox. If you, like you said, he's been 99 for months. I mean, if you start your oxygenation starts to go down, you're probably going to be sick with a cough or shortness of breath. You're going to feel it also. And I don't want to have people become more focused on taking their oxygenation level every day. I don't think that that's going to prove to really be that helpful.
Thank you. Joe asks, I assume I can still get COVID after the vaccine because it's 95% effective. If I get COVID after the vaccine, will it be less severe?
That is not proven, but a great question. And I do think that will probably be the case. Kind of like you hear sometimes with the flu shot, that, you get the flu shot, you might still get the flu, and the flu shot is only 40 to 60% in a given year effective. So even more chances of getting the flu, but perhaps you're going to get it less severe. And I do think that will pan out to be the case, but I have no science to back up my saying that besides what I know about vaccines and antibodies.
Great, thank you. Stephen asks, can you comment on this? He heard from a friend that is scheduled to get the vaccine in a few days that his doctor said to take a Tylenol before the vaccine. Can you share your thoughts?
I don't think there's any harm in taking a Tylenol before the vaccine. 80% of the people, as I had in that slide, do have a really sore arm. I had a really sore arm for 2 days. So, if that helps you feel better, that's fine. You don't have to take a Tylenol before the vaccine. And I don't know if, I wouldn't say, oh, everyone should, but there's no harm in doing that if you're, especially if you're someone that is really sensitive to, having a sore arm or being sore or pain. We all have different pain sensitivities. So not a bad idea.
One of the questions is, the CDC has said that people over 65 and those with underlying conditions should be the next group to be vaccinated. I think we've addressed this one already. I'm sorry. My understanding is that in California, it's only 65 and over that will be next. Do you know why?
No, I think that's absolutely right. And I think that they did amend or, change that so that the next group, the 1C group, will be 65 and those with underlying conditions as well. So we're not there yet in California, but hopefully that will be soon.
Perfect. Another question is, I read that fertility for men and women with vaccines is a serious and prohibiting issue for younger people. Can you explain?
Sorry, I missed what you said.
This person read that fertility for men and women with vaccines is serious and prohibiting issue for younger people. Can you elaborate?
I wish I had more information on that. Um, I don't know the answer to that. There isn't anything we know right now about fertility. The vaccines have not been so. I think it's the Pfizer. The Pfizer vaccine has been studied in 16 and up, and Moderna in 18 and up. But we don't really have data on that. So I can't say. When we look at other vaccines in the past, we don't see an effect with most of them on fertility. But I can't answer that with any science to back it. So I don't know. I know there are people concerned about it. I know people think about their children. And right now, I would say that we don't know yet about children. So I don't think kids, you know, I don't think kids should get the vaccine yet because we haven't studied it. Starting to, but we haven't done it yet. And of course, this is my opinion. This is what some of these questions, like there is no answer out there. So I'm giving my best opinion based on what I know.
Right. Thank you. Beryl asks, I read that California has withdrawn a batch of Moderna vaccines at Petco Park because too many people had an allergic reaction. She has sensitivities to most foods and preservatives. Should she go to Petco Park to try to get a vaccine?
So right now, the CDC website. So you're right. There was a batch of Moderna vaccines that they saw 6 people have a severe allergic reaction to. So they did withdraw that batch, and they're looking into it. They haven't yet figured out what it is. Each batch is made with different things. Like I was talking about that polyethylene glycol. Maybe that batch had a little too much or something like that. Maybe was tweaked, and that's why we saw that, but we don't know that for a fact right now. If your history of allergic reactions is pretty minor, I don't think that should, stop someone from getting the vaccine if you want to get the vaccine. But and again, we still don't know what the data is on that batch and why we saw 6 people have that allergic reaction. But I don't think that a really minor kind of food allergy should stop you, from what I can tell.
Thank you. There's a question says, I heard vaccines from China and Russia are being distributed around the world. Would those be given in the US soon?
I don't, none of them are currently being studied in the US. I don't think the FDA would allow emergency use authorization unless the vaccines go through a phase 3 trial in the United States. So no, I don't think that, like, for instance, the Sinovac, I think, is in China. I don't think that we're going to be seeing it anytime soon. Now, I don't know what's going to happen in the future, but right now it's not being studied in a phase 3 trial in the US. AstraZeneca, for instance, which is one of the ones that is in a phase 3 trial, is already approved in many countries in Europe and South America, but we're not giving it out yet in the US until the FDA sees the trial data from here.
Great, thank you. Christina Williams, she just commented that she had a very sore arm for 2 days after the vaccination, and her friend who took the Tylenol did not. So just a comment from the earlier question. So another question is, if someone has bad reactions to the regular flu vaccination, should they be wary of the COVID vaccination?
Yeah, and by bad reactions, it depends on, what you mean. Like if someone had severe allergic reaction with the flu vaccine, some of the additives are similar in different, the things that stabilize what we're trying to deliver are similar. Some of those sort of, not the actual medicine, but the things in the vaccine. I do think that then it's something to discuss with your doctor if you've had a severe allergic reaction, or depending on what this bad reaction is that you've had.
Thank you. Question is, I'm getting the second shingles vaccine soon. Would it be okay to take that second shot and get the COVID vaccine as well? So getting them close together?
Yes, that's fine.
Perfect. Let me see. How long after the second injection does the body become immune to the virus? 10 days or 3 weeks?
So from what the immune response in general, it takes about 2 weeks to kind of reach a pretty good level. I would say if you're thinking about after your second vaccine, when are you fully immunized? I would say 2 to 3 weeks.
Perfect, thank you. After getting the vaccine, what is the procedure for staying on site to have a doctor or nurse monitor for allergy symptoms? How long would they have to wait?
So what they based it on is most people who have an allergic reaction to a vaccine see the symptoms within 15 minutes. So when, for instance, for all of you that go to Petco Park or one of the super centers, you will be in your car, you'll get your shot, and then you will be observed for 20 minutes. If you're someone that has a history of allergic reactions to vaccines, but they're not super severe, but you're worried, I would let them know, because then I would recommend, and I think the CDC website also does recommend, that you be observed for 30 minutes just in case. So, and they definitely, I think, can accommodate that. So that's just something to know if you're one of those people that is more worried about that. But in general, if you just show up and you don't have a history like that, you'll be observed for 20 minutes.
Thank you. Can you speak to whether women should consider only getting vaccinated outside of the luteal phase of ovulation? This person vaguely remembers the suggestion due to those phases being a period of lower immune system strength for women. She's concerned that she had a bad reaction to Gardasil years ago.
That's a really interesting question. And honestly, I haven't read anything about that or the phases like that affecting vaccination. So there's nothing that I honestly know about that. I don't know the answer to that question. I haven't, I don't think that there's any data maybe that I've seen to support that, but I don't know. That's an interesting question.
Okay, perfect. Mary asks, should people who have the virus take the vaccine?
You mean people that have already had COVID-19?
Who I'm assuming who currently have it.
So right now, most of the experts are saying you should wait 90 days because for the first 90 days, we do have some pretty good data to show that you're immune. Most people are, not going to get reinfected within 30 days. After that 30 days, things are very inconsistent. Some people may be immune longer, and probably are, and some people may not, and it's very inconsistent. And so what right now the CDC is recommending is that even if you've had COVID, you still should get the vaccine. And what the experts that I've read have said, the infectious disease and vaccine experts, is that you can wait 90 days after COVID to get the vaccine, so that we have a more consistent protection across the population.
Great, thank you. Joe asks, that Pfizer BioNTech trial results were submitted to the FDA, and the results have over 3,000 cases, mostly in the vaccinated group, being referred to as unconfirmed cases. Has that lowered the effectiveness of the vaccine?
I'm sorry, can you repeat that question?
Yes, that Pfizer BioNTech trial results were submitted to the FDA, and the results have over 3,000 being referred to as unconfirmed cases. Has that lowered the effectiveness of that vaccine?
Not that I know of. No, I don't know about that. I don't know about that. I haven't heard that.
Barbara asks, do you have any information on the developing Bell's palsy after receiving the vaccine?
So that is something that can happen after any virus or vaccine, Bell's palsy. So they're probably now in the initial EUA, I didn't see any cases of that. I'm sure as we move on to the larger, when we get into the millions of people, we probably will see some cases of that. And we'll just have to wait and see what the numbers are on that, and if it's more common than with the virus or, things like that.
Great, thank you. Another question is, I had an antibody test that can you explain how that happens?
It came back inconclusive.
Yes.
So antibody tests, going back to testing, antibody tests are those tests that tell us if we had the vaccine sometime in the past, and thus our body has made antibodies against that. I mean, we had the virus sometimes in the past, not the vaccine. And so that our body has made an immune response, and we've got antibodies circulating in our blood that can fight the virus if we were to get sick again. A lot of there's so many out there, and a lot of them are not very accurate. So that doesn't surprise me if it came back inconclusive. They're not the most accurate tests, and I don't know if they're very useful right now either for most people. So I think they'll be more useful in a public health sort of scenario. So it really kind of just, I don't know. It doesn't surprise me that it came back inconclusive, or if it came back negative, but you're sure you had COVID. I mean, that could happen because they're not very consistent.
Thank you. Joe asks, what is your thinking for when the next vaccine will be given the emergency use authorization?
Well, as far as when, it looks like the AstraZeneca one and all of them are coming up pretty soon in the next, one of them had said even the end of January, but it depends on how many cases there are, how they can get to their data points. So probably in the next month, we're going to see, depending on what the data looks like, and I don't know what it's going to look like, but I'm assuming if it looks good, we'll probably see more vaccines getting this emergency use authorization in the next few months. And like I said, the AstraZeneca vaccine is less expensive and it's easier to distribute because it can just be put in a regular freezer, and it's not as unstable at, it doesn't need to have these low temperatures, which makes it really hard for distribution, which now has become sort of the, we want to get people immunized. The people that want to get immunized, we want to get them immunized as quickly as we can so that we can, go back to our normal. So these new candidates might help that happen sooner. But we've got to see what the numbers are and what the data is and how effective they are as well.
Thank you. I know we've covered trials, but this asks participants in the phase 3 trial, what ages, races, medical history, and multitude of drugs they may be on. Has all that been tested in the trial? And how do you find the components of the vaccines?
You can look up the components of the vaccine. You can look it up on like all the different components. And as far as the participants in the trial, yes, they try when you all clinical trials, when we enroll people, there is something called the inclusion and exclusion criteria for the participants. So anyone can look up for the Pfizer trial and for the Moderna trial and for any of these trials, what was their inclusion criteria, meaning who are the people that they included or allowed to include, and then who are the people that they excluded. And what I often tell people to do is go look that up, think about yourself, answer the questions, and see, would you have been allowed to be included in that trial? And if so, then the results of that trial would probably be similar for you. But if you have something in your history that's one of their exclusion criteria, then maybe you need to look a little further into whether this is a good decision for you or not. So that's something you can look up, or I do have an Instagram, and if you have specific questions like that, or how to get to that, or how to find that, you can ask me on my Instagram, and I will send you a link if you want to know more about, things like that. I will say that the trial, the FDA did require that the participants in the trials did span a pretty broad age range. Like I said, they didn't just test 20-year-olds and say, wow, this is safe. They tested people in all the age groups, and they had certain percentages. They tested different ethnic groups, different nationalities, to make sure that everyone feels as safe as they can taking a new vaccine.
Perfect. Thank you, Dr. Hacker. I think those are all the questions. And we have a few more minutes. If anybody has an additional question that has not been answered, please feel free to submit. Let me see, I just got one. Yeah, no, I think we're all set. I think we've answered them all. Dr. Hacker, thank you so much for this valuable information. Again, I think we all learned a lot and have some homework to do ourselves, but thank you for being part of our Distinguished Speaker Series. Again, if you have any additional questions for Dr. Hacker, what is your handle for Instagram, Dr. Hacker?
It is Mona Hacker MD. I think I have it, here it is. I can just put it up for, it's at Dr. Mona Hacker.
Perfect. So if anybody has any additional questions, you can contact Dr. Hacker. There it is, via social media. And again, a big thank you. We're very hopeful for this new year and for this new information being released to us. So thank you for your time and have a great day. Thank you all. Stay well.
Thank you for coming.